Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the Public Health Weekly Update with data accurate through December 8th, 2022. As this is the last episode before the students go home for the semester, I thought I would do a top 10 list, if you will. What are the top 10 things that I think are the greatest threats to human health and well-being? And this will build on all the last year's worth of weekly updates. So if you want to go back and review all them, you probably won't be surprised where I'm going to go with this. But I'm not going to present them from 1 to 10. I'm going to present them in alphabetical order, and I'll explain why at the end. So the first thing I worry about is climate change. Finally, this year, after a great deal of time, people are starting to pay attention to climate change. Ocean flooding, glacier melting, record temperatures, drought, floods, wildfires, all of these things are finally starting to get people's attention to realize that climate change really is a serious and threatening issue for human health and well-being. This year has also been a tremendous time for recognizing emerging infectious diseases globally, domestically. This is a time when we're coming to realize that there are a lot of infectious diseases out there, and especially as we're seeing in Ohio and other places, if you don't get vaccinated against them, these diseases can recur. The third thing on my list is lack of access to healthcare. The United States is one of the few countries that hasn't figured out a way of providing healthcare to everyone. And as you can see on the right-hand side of this, folks that are uninsured have a significantly greater probability of not being able to pay for healthcare. But this isn't just a domestic issue, it's an international issue as well. Every year, 1.2 million children under the age of 5 die of pneumonia and diarrhea. Pneumonia that can usually be treated with antibiotics that cost less than $1, and diarrhea that can usually be treated with rehydration solutions or prevented with clean water. So lack of access to healthcare is killing people everywhere. Overpopulation, of course, is a major issue. It was in October of 2011, just 1 decade and 1 month ago, that the world's population passed 7 billion, and this last month it passed 8 billion. And of course, this population is not evenly distributed everywhere in the world. It tends to be located in those parts of the world that have some of these other issues that we're talking about. If you look at the growth in human population, it's pretty remarkable. My grandfather was born shortly before 1900 when there were less than 1.7 billion people. My father was born in 1927, slightly before 2 billion people. I was born in 55 when there were less than 3 billion people, and now there's 8 billion. In other words, in my lifetime, 5 billion people have been added to the world's population. And yes, I know all the arguments, if all the resources were equally distributed, we would be fine, but they're not, and we're not. The next thing that really worries me is reduced trust in science, which we euphemistically call misinformation. You know, it's one of the realities is if you look at all of these issues, we've got to address them with science. We've got to address them with care and science. And misinformation is deeply worrisome because it prevents people from understanding science and it prevents people from believing in science. And I think we need to start calling it for what it is. Sometimes it's mistakes. Sometimes it's things people don't know, but sometimes people are frankly lying. And I think we have to call it out. The next thing that worries me, of course, is pollution. We've talked about plastic pollution. There's air pollution, water pollution, many other types of pollution that in the long term pose a real threat to human health and well-being. Socioeconomic inequality. All you have to do is look at this chart that compares income per capita across the bottom and life expectancy, and you see a direct relationship between income and life expectancy. Unequal distribution of resources causes people to die young. And people living in the poorest 63 counties in the United States have a life expectancy below that of half the countries in the world. The next one may surprise you a little bit, and that's the pressure for social mobility, i.e. the pressure to migrate. We know that migration happens. We often have an image of migration of poor people moving from one country to another, but I like to show this as well, and this is my ancestry, and you can see that about 96% of my ancestors were somewhere in the British Isles, and they came to America. Well, they didn't come here by osmosis. They migrated here. So migration isn't necessarily a bad thing, but what it does is it puts tremendous pressure on countries economically and in terms of resources, and then it causes tension, and that builds up over time. And that leads in a way to the next issue, which worries me, which is the increased level of stress and depression that seems to exist in the world. We have problems both in the so-called developed world and in the undeveloped world. Why do people migrate? Because of stress. And then, of course, we have all the issues coming out of the war in Ukraine. And that leads me to my 10th and final issue, which is war. And I did not think in my lifetime I would see a World War II type invasion of one country into another. Now, you may ask, why didn't I list these from 1 to 10? Why didn't I do a Dave Letterman and list them, 10, 9, 8? Well, the reason is that these are inexorably intertwined. If you think about it, climate change causes pressure to migrate, right? It also increases emerging infections. As it gets warmer, mosquitoes live higher in altitude, right? It can increase stress and depression. It can cause socioeconomic inequality as people lose their farmlands. And then anytime you've got pressure on people to migrate, it can lead to war. Of course, overpopulation can contribute to climate change. Pollution contributes to climate change, and misinformation. And as we go around this list, you see how interrelated all of these factors are with each other. And so you can't deal with any one of them without recognizing all of them. So with so many problems facing mankind, how do we start? If you think it's simpler than we might say, we have to start by recognizing that all of these problems impact all of us, right? Just because we may not be in a place where climate change is immediately impacting us, you have to realize that it does. Even if we're not in the country that's being invaded, you have to realize that war impacts all of us. And recognizing that, we also realize that these problems can only be solved if we work together. And that starts with a very basic and simple concept, and that is we have to care about each other. My definition of public health is very simple: evidence-based altruism. Evidence-based means we're scientists. Altruism means we care for people. So how do we take that? It doesn't matter which of these issues you care about. Just start with one. Start untangling this web, because if we can start untangling it, perhaps the whole thing can be torn apart, and we can live in a more just and equitable world. For the students going home for the holidays, I hope you have a wonderful, relaxing holiday season. For the rest of you, I hope to see you in the coming year. And until then, please have a very happy and healthy holiday. Please feel free to share this video and all the others with anyone who might be interested. All of our previous videos are posted on the website. And if you know anyone who'd like to be added to our mailing list, please let me know. As always, I'd like to thank Derry Young for editing, producing, adding captions, and posting this video. And if you have any questions about anything that I've said today, or any other weekly issue, or any other evolving public health issue, let me know. I look forward to hearing from you. Thank you very much. Until next week, please be well.